welcome to the deep dive. Look, if you or someone you're caring for has had vascular surgery recently, feeling a bit lost about what comes next, well, that's completely normal. It can be a lot. So, our mission today is simple. We want to break down the information about follow-up care, make it clear, and hopefully make you feel more empowered. We're asking, what happens after the surgery? Why is sticking with the checkup so important? Think of it like this. You get a big engine repair on your car, right?
Yeah.
You wouldn't just drive off and forget about it. Those follow-up tune-ups are crucial, even if the car feels fine. Your body kind of needs that same approach.
That's a great analogy. It really is. This follow-up, it's not just ticking boxes. It's a really vital part of your long-term health plan. It's designed to keep you ahead of any potential bumps in the road. The main idea, the primary goal, is to spot any tiny changes, maybe a blood vessel starting to narrow again really, really early, often before you'd even notice anything yourself. And finding things that early, it just means managing them is usually much safer and often simpler.
Right. Simpler is always better.
Yeah.
So ignoring those early signs, even if you feel okay, could lead to bigger problems later.
Yeah.
Like seeing a tiny crack in a wall versus dealing with it when it's about to fall down.
Exactly. That vigilance, that ongoing monitoring, it's truly your best ally in this.
Okay, so how does the healthcare team actually keep watch? What can you expect?
Well, the simplest part is what we call clinical monitoring. That's basically your regular chats with the doctor, going over how you're feeling, your health history, maybe a physical exam, just keeping tabs. But for catching the silent changes we talked about, the real workhorse is something called Duplex Ultrasound, or DUS for short.
DUS. Okay, what is that exactly? Is it complicated?
Not at all, actually. It's non-invasive. It uses sound waves, kind of like sonar or an echo, to literally see inside your blood vessels. It shows us the structure and measures how the blood is flowing through them. It's completely safe, painless, and, most clinics have it readily available.
So it's like getting a live video feed of your arteries. That sounds useful. Is there a typical schedule for these DUS checks?
Pretty much, yeah. You'll usually have a first one, a baseline scan, fairly soon after your procedure, maybe within the first month, sometimes up to 3 months. Then the pattern is often every 6 months for the first year or two. After that, it might stretch out to once a year or maybe every couple of years. It depends a bit on the procedure. For some types of repairs, it really is a lifelong checkup schedule. And certain things like if you have diabetes or if a previous scan showed a tendency for narrowing might mean you need those DUS checks a bit more often.
Okay. That makes sense. So DUS is the main tool, but are there times when, you need a different kind of picture, something more detailed?
Yes, absolutely. Sometimes we do need a closer look. That's when we might use other imaging tools like CT scans or MRI scans. A CT scan uses X-rays and sometimes involves getting an IV contrast dye to make the vessels show up clearly. And MRI uses powerful magnets, not X-rays. These give really detailed images, but because CT involves radiation and both might use specific contrast agents, we tend to save them for situations where the DUS results aren't quite clear or we need to confirm something specific we suspect.
Got it. So different tools for different needs, but always aiming for that early detection. Now, you mentioned it depends on the procedure. Does the follow-up change depending on where in the body the surgery was?
It does, yeah. The basic goal, early detection, stays the same, but the specifics can vary a bit. For example, if you've had work done on the carotid arteries, those are the ones in your neck supplying blood to the brain. Procedures there, like cleaning out plaque or putting in a stent, are done to prevent stroke. So regular DUS checks are really key to make sure they stay open. Then there's the aorta, that's the biggest artery running through your chest and belly. If you've had a repair for an aneurysm, like a bulge, where they insert a fabric-covered tube called a stent graft, well, that often requires lifelong follow-up.
Lifelong. Why is that so critical?
It's mainly to watch for something called an endoleak. That's where blood manages to leak around the graft inside the aneurysm sac. If that happens, pressure can build up again, which isn't good. CT scans are often used here. Now, people sometimes worry about the radiation with CTs, and that's understandable. But for this specific situation, the risk of missing a serious endoleak is generally considered much higher than the risk from the scan itself. So the benefit of catching it early really outweighs the risk. Sometimes, for the belly aorta, if things look stable, DUS can be an alternative later on.
Okay, that distinction is important. What about arteries going to other organs, like the gut or kidneys?
Right, the mesenteric arteries to your intestines and the renal arteries to your kidneys. These are obviously vital. Follow-up here, usually with DUS, is definitely recommended because narrowing in these vessels can cause serious problems for those organs, even if you feel perfectly fine at first.
And the legs? Lots of people have procedures on their leg arteries.
Yes, very common. For leg arteries, it depends a bit on what kind of procedure was done. If you had a vein bypass graft where the surgeon uses one of your own veins to create a new path around a blockage, then DUS follow-up is highly recommended. Think of it like a custom-built detour road. You want to make sure it stays clear and functions well. Catching any narrowing early in a bypass graft gives us the best chance to fix it and save the graft itself.
Okay, so DUS is very important for those bypasses. What about other leg procedures, like stents or balloons?
For stents, those little mesh tubes or angioplasty where a balloon widens the artery, DUS is definitely helpful for monitoring. But maybe even more crucial here are your symptoms. How are you feeling? Are you noticing any new leg pain when you walk? Can you walk as far as you could before? Any changes like that, even small ones, are really important signals. Telling your doctor about those changes right away is absolutely vital.
That really highlights the patient's role, doesn't it? It's not just about showing up for scans. You're an active participant.
Oh, completely. Your role is essential. It's easy to think, oh, I feel great, I can skip this appointment. But that appointment might be the very thing that catches a small issue before it becomes a big one. So attending all your scheduled follow-ups, truly, even when you feel perfectly well, is probably the most important thing you can do. And ask questions. If you don't understand something about your scan results or the plan, ask. Being informed makes you a stronger partner in your own care.
It really sounds like this follow-up isn't meant to be a burden, but more like a partnership, a team effort between you and your doctors, all focused on your long-term health.
Exactly. It's a partnership built on vigilance and communication. And looking ahead, it's interesting to think about the future. As medical science keeps advancing, maybe we'll find even newer, perhaps simpler ways to monitor vascular health, making these essential checks even easier for patients. It's an ongoing journey of learning and improving for all of us doctors and patients alike.